The Doc is In is sponsored by Amada Senior Care.
Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio.
Always one of the highlights of our week, and this morning he's focusing on button batteries and the risks that come with them.
Yeah, this is one of our legit fears in medicine is the button batteries. And so we've got a couple of segments coming up this morning on the issue and some of the things to try to fight that. So let's dive right in. When people ask about some of the greatest fears of emergency medicine, one of them is the ingestion of button batteries. These are also known as watch batteries, but are the ones that are flat and look like coins. Unfortunately, children learn much about their surroundings by putting things in their mouth. This can sometimes result in an ingestion, and sometimes they get stuck. Some things aren't a big deal. They'll pass just fine. Others require removal, but very few of them are time sensitive, but button batteries are one of them. The moisture of the body allows for the battery to activate and can quickly cause tissue damage and permanent harm. This damage starts soon after ingestion, but progresses very quickly if the battery becomes lodged somewhere, especially in the esophagus. These can be detected with an X-ray imaging and require emergency intervention once they're found. The challenge is that it may not be clear that the child has ingested anything until there's signs of the damage. That's what a button battery, the button battery on imaging looks like a double ring sign. So this one right here, if you look very closely, you may have to get close to the screen, you can actually see that there's a double rim sign. So you can see a lighter rim on the inside and then the dense ring on the outside. Also, if you look from the side, you can actually see the shape of the battery a little bit better, but it can be very difficult to tell the difference between a coin unless you know what you're looking for. The key that is if there is any concern for ingestion, getting help right away. Also making sure that you're vigilant as parents, or if you have small children around, keeping those button batteries away from children. Coming up, we're actually going to talk about some of the technology that help protect your children and alert parents with regard to the button battery and possible ingestions. In fact, there's an emergency physician out there that did the experiment herself, and we'll have a little quote from her when she tested that. Better her than me at this point.
Let's say you didn't see your child ingest this battery. Are you talking about this next hour, or can you answer it now? What are some signs that they could look out for that they know that there's a problem happening?
Well, sometimes they'll say something, but really it comes up into the symptoms that happen afterwards. Sometimes they're spitting up, sometimes they're not eating, but unfortunately what you tend to see is sometimes with the damage, which is the blood and the tissue damage that you're starting to see, or the pain that they're seeing. In fact, a lot of times with ingestions, even coins, we're not catching those for 4 or 5 or 6 days because people don't realize it until they start to get symptoms and think there's something else going on. And so, unfortunately though, this is something that causes damage within hours, not days. And so catching it as soon as possible, and most importantly though, just keeping it away from kids.
And pets as well, I would imagine.
Well, the interesting thing with pets, we don't see it as often, just because of the size of the esophagus and the type of things and the way that children take things in and get stuck in the esophagus.
Oh, interesting. Well, look for more next hit.
About 30 minutes?
About 30 minutes.
We'll be here.
Thanks so much. We'll be right back.
You're watching Fox 56 News. Our home, your news.